Well, another Christmas that's been invaded by COVID, this time by Omicron. That seems to be all the talk. Although milder, it would appear, than Delta. Let's get the latest on COVID. Dr. Kevin Kavanagh is affiliated with Health Watch USA and is a frequent contributor here. Dr. K, good morning, sir.
Good morning.
Israel's already up to its fourth dose of COVID. What do they know that we don't know?
Well, that's correct. They don't mess around with this virus. And I think that's one thing people need to realize. Immunity wanes, whether you've had a previous infection or if you had a vaccination. And so that you need to get your booster, at least get your third dose. Because the data that is coming out on Omicron, as you said, it may be milder, but it still needs to be respected. You have to realize, Cruiser, that data where they have really glowing statistics on how mild this is, what they've done is looked at all of the cases of Omicron that comes in, how many are hospitalized, and then compare it to Delta. Well, the problem there is that they're getting flooded with Omicron cases, and a large percentage of these are reinfections or breakthrough infections, which are mild, but those patients shouldn't have been infected in the first place. If your immunity is not up to par to this virus, in other words, you're immunologically naive, you haven't had an infection, you haven't had a vaccination, data from England says that this is maybe 15 to 20% less of a chance of being hospitalized. And that's compared to Delta. Of course, Delta was more severe than the other variant. So maybe this would be as severe as the Alpha variant. But nevertheless, it's something you don't want to mess around with. And if you're in the category of patients where it's been more than 4 to 6 months since you've had a vaccination, or since you've had an infection, or if your infection was only very mild, you really, really need to consider getting a booster. And all of those people who've had an infection, get vaccinated. Consider that your booster, and there's abundant research to show that people who've had a previous infection and then get vaccinated are not only less likely to get infected by Omicron, but they are also enter into a category of super immune, where their breadth of antibodies is huge, and they're going to be better off to fight off additional variants. So please get boosted and get vaccinated.
What do you think about the pills that have been approved? Are there two of them, doctor? I mean, I saw where there's one to treat high-risk COVID patients, and then there's another drug from Merck that's been cleared for adults 18 and over who've tested positive for COVID, and so you almost take it as something to try to relieve, I guess, your symptoms? Or does this drug actually, unlike cold medications, does this drug actually help eradicate the virus in you? Can you explain the two drugs and what do you think about them?
Well, I will. First of all, that people need to realize these drugs are not widely available yet. And in fact, They probably won't be available to help out with Omicron. We really do need to use what's here, which is vaccinations and follow public advice. But there are two pills. One is paxlovid, and this is from Pfizer. This pill is just about 90% effective in prevention of hospitalizations, but it has to be taken very early. From my understanding there's a lot of cross-reactivity with other drugs, so not everybody's going to be able to qualify for that. The other drug is molnupiravir. This is from Merck. This drug is only 30% effective in prevention of hospitalizations, so not nearly as good. And there's also some concerns of safety. Mind you, these are rare risks, but could occur. And that's one of the reasons why it just squeaked through the FDA approval. I believe it had a 14 to 10 vote on the FDA panel. So both of these drugs are going to be important in the future. Monoclonal antibodies are still here, but unfortunately, with Omicron, only one of the monoclonal antibodies made by SmithKline is effective, and it's not in very good supply. So don't expect to go down and get really effective treatment if you come down with this. The best way right now is vaccination wearing N95 masks. You've got to upgrade your masking and try to do a lot of home testing. And I think that is absolutely key, because if you come down with Omicron, you are going to be in a situation where you may have a very stressed healthcare staff. You have healthcare staff that may be off of work just because they've had the virus. Remember, it gets breakthrough infections. And you do not have as many drugs in the armamentarium to be treated with. So let's be very cautious over the holidays.
I brought this up earlier in the program, and whether these pills are a game changer or not may depend on whether people who refuse to take the vaccine will take the pill. If you got a problem with the vaccine, you think it's rushed, you don't trust it, or are you going to trust the pill?
Well, it's hard to tell. People
remains to be seen.
Yeah, people do like to take pills. I mean, I think far too commonly with some of them. But they don't trust the FDA much. They would rather take something that hasn't been approved and researched rather than something that's been researched, approved by experts, and is mainstream. And so it is quite frustrating. We do have the knowledge to prevent spread. We have the tools in our armamentarium to stop the virus. We're just not utilizing them. So the situation we're in right now, a lot of it is our own fault.
Well, and you talk about the testing and taking or getting an at-home test, but from what I understand, those are extremely difficult now to acquire. Just this week, I guess the president's going to distribute 500 million tests, but this isn't going to help as far as the new variant is concerned, just like the new pills that have been approved are not going to help, are not going to be around in time for this particular variant. It sure would make things easier and put people's minds at ease had we had enough fast, easy to use, rapid home COVID testing kits. We should have had them, and we still don't. We're still waiting on them, maybe next year.
Well, and that's absolutely correct. And one of the things we advised on this show, well, before Thanksgiving, was to load up on these tests. At that time, they were readily available at Sam's. We bought a bunch of them, I believe $14 for a package of 2. And hopefully our viewers did that. Right now, they are rare. It's very hard to predict what's going to happen with this pandemic or even this surge. I do hope, because this virus spreads so much, it may be the most contagious virus we've ever seen, that this peak will go up fast, be very high, cause a lot of problems, but then come down very fast. I don't know that for sure, but what I am fairly sure of, we'll be out of Omicron before we get the home tests. I just think that is way behind schedule. This should have been done prior to the Delta surge. People in Europe and countries in Europe were doing it in the spring. We talked about that on this show, but yet just inertia. So it's not been a good response, as far as I'm concerned, from the federal government.
Yeah, an FDA scientist, this was a ProPublica, had a horror story about a medical company that developed what it thought was an inexpensive, fast, accurate testing system, then ran into a brick wall of unresponsive federal bureaucracy trying to get it approved. In fact, one FDA scientist who vetted COVID-19 test applications became so frustrated he quit the agency this year. He says, quote, "They're neither denying the bad ones or approving the good ones." He didn't want to give his name, but yeah, it's inexcusable that this testing regimen or the testing infrastructure hadn't been built and fortified way earlier this year.
Well, you're absolutely
where we are now.
Absolutely right. And I'm not sure of the exact reason, but I can tell you the European countries are ahead of us on everything. Almost anything that we're approving, even the decreasing the quarantine time from 10 days to 7 days, we're following other countries on that. So it's very frustrating. We need to start to become a leader in the world in controlling infectious disease, not a follower. We're primarily using data out of England, out of Israel. It's frustrating, and it does hamper our response, and it hampers the safety of our viewers.
Dr. Kevin Kavanagh with Health Watch USA. Doctor, thank you very much for your contributions over the past year, and I hope you and your family have a very Merry Christmas and a Happy New Year.
All right. Thank you very much. We'll see you next year.